Hey everyone, welcome back again, and let's continue the pharmacology series that we started with another high alert medication, which is potassium chloride. We also call it KCL. If there is any absolute non-negotiable rule in nursing school that will fail you instantly in your exam or in your clinicals or also when you practice, is never push potassium chloride, never give IV push when it comes to potassium. So if you take an injection and push the potassium through IV line in your patient, you're not giving them any medication, you're actually giving them lethal injection that will stop their heart. So to understand, potassium is very critical for our heart muscles. It relaxes and contracts heart muscles. If you give IV push in concentrated form, it will cause a serious cardiac arrhythmias by overloading electrical activities that will cause ventricular fibrillation and ultimately will stop our heart. That is why always remember potassium is very high alert medication, so it need extra verification with other RNs, it need exact measurement, it need monitoring, and we have to be very careful when it comes to potassium. So there are a few rules that we have to follow when it comes to potassium chloride. You always need to use electrical pump to give potassium chloride because then they will get the amount in controlled form, so patient is not getting too much or too fast, and it would be safe for patient. The other rule is always check the order. Usually the standard safety limit for potassium is 10 milliequivalent per hour, but always double check the order before you administer KCL. So always remember, when it comes to potassium, be very cautious when you administer the potassium and always double check your order, because potassium is very important when it comes to balancing the heart's electrical activity, how it pump, but too much at once can stop it. That's all about potassium. See you later with another medication. Bye.